In 2021, we announced the Ballad Health Niswonger Children's Network, a regional system of care that marks the next phase in high standards of healthcare and well-being and the start of brighter futures for children across the Appalachian Highlands. 1 year later, we're excited to bring you big updates from these Niswonger Children's Network programs.
In March of 2021, Ballad Health Niswonger Children's Network made an investment in Strong Futures, a program housed in Greenville, Tennessee, to address mental health and substance use disorders for pregnant women and young mothers in our region. The program offers multi-generational outpatient services and resources for families, as well as a residential component to provide a safe and healing living environment. We have 11 beautifully designed rooms for women and their children through age 9 who qualify for the residential portion of the program, and a state-of-the-art outpatient clinic comprised of outpatient treatment rooms, a group therapy room, and a playroom for children who may be waiting on their mothers during treatment.
Since the program began, we have served and impacted over 800 mothers and family members from all over the region. We are proud of these ladies and their success in recovery, and are honored to be able to offer these services for women and families in our communities. Strong Futures addresses mental, physical, and emotional aspects of addiction recovery, but also reaches beyond the barriers of traditional health care by addressing poverty and educational needs. We provide financial counseling, literacy improvement, parenting education, and workforce development, followed by intensive case management and relapse prevention services to set these families up for success. We really are taking a holistic approach to change the culture and break the cycles of addiction for these families.
In September of 2020, thanks to a generous donation made by the J.D. Niswonger family, we opened a pediatric emergency department here at Bristol Regional Medical Center that features 6 exam rooms specifically designed for children. Everything from the size of the equipment to the layout of the space was designed with children in mind. The brighter colors and other kid-friendly features create a more relaxed environment for our smallest patients. Child life specialists are also on site to help children cope and ease their fears. Our providers are specifically trained in pediatric emergency conditions and have access to telehealth services at Niswonger Children's Hospital should a higher level of care be needed. Since the J.D. Niswonger Pediatric Emergency Department opened, we've treated thousands of children with a wide range of injuries and illnesses. In less than 2 years, the Pediatric Emergency Department has made a huge impact in Bristol and our surrounding communities. We are so grateful to the J.D. Niswonger family and their extremely generous gift that gives us the opportunity to provide a specific emergency department for children in our region.
In March of 2021, Ballad Health announced an $8 million investment for women's and children's services in Kingsport here at Indian Path Community Hospital through the Niswonger Children's Network. Indian Path is beginning a transition into a center for women's and babies. Part of this transition will include a new pediatric emergency department and an extensive renovation of our family birth center. We have worked closely with the Visioning Committee and the Ballad Health Board of Directors to determine services needed to improve access and provide more focused care for our women, children, and their families here in our communities. Our pediatricians and team members have wholly embraced plans for the Pediatric Emergency Department that will open in the summer of 2022. We are currently in the design phase for the Family Birth Center renovations with a goal of beginning construction later this year. We are proud to be part of the Ballad Health Niswonger Children's Network and look forward to the specialization of care this addition will bring to Kingsport and our surrounding communities.
As part of the Ballad Health Niswonger Children's Network, one of our goals is to proactively deliver services to children throughout the Appalachian Highlands to improve and enrich their lives. Last March, we announced the opening of the second Niswonger Children's Hospital Children's Resource Center at Johnston Memorial Hospital in Abingdon to better serve the families in Southwest Virginia. The Children's Resource Center provides quality and trusted information for families, schools, and community organizations. Our programs are constantly growing and cover a wide variety of topics, including swim safety, literacy, wellness, and injury prevention. The Children's Resource Center works closely with the Strong ACC to determine what needs specific communities have and how to best address barriers and provide a support to women, children, and their families. We are thrilled to offer our services at Johnston Memorial Hospital and to expand support into Southwest Virginia.
In 2020, we announced the Strong Accountable Care Communities, or Strong ACC, in partnership with Ballad Health Niswonger Children's Network. STRONG stands for Striving Toward Resilience and Opportunity for the Next Generation, and is a major initiative for our population health team. With Ballad Health and the United Way of Southwest Virginia serving as the backbone organizations, over 300 community organizations, from big businesses and school systems to faith-based organizations and local not-for-profits, have come together as part of the Strong ACC to address issues such as adverse childhood experiences and poverty. We've really partnered together to address how can we best assist communities, and then stand up programming and services based on those specific needs. Since the announcement was made, we've developed Strong Pregnancies and Strong Starts, where community health workers assist pregnant women and new moms in getting access to basic necessities such as food, diapers, transportation, and even scheduling and attending doctor's appointments. Whatever the need may be, we want to be part of that solution. We look forward to further serving our communities as the Strong ACC grows to meet needs across the Appalachian Highlands.
For the 10th straight year, the Appalachian Highlands community will have the opportunity to give life, health, and hope to thousands of children in the region through our annual Radiothon. A year ago, we announced the formation of the Ballad Health Niswonger Children's Network, and this year we are pleased to announce another exciting project. The Ballad Health Niswonger Children's Network Capital Campaign, Hope Rising, is officially kicking off to the public at this year's Radiothon. This campaign has a goal of raising $30 million for improvements in children's health in our region. $18.5 million have already been committed in gifts from generous donors. Gifts made to Hope Rising will help improve Niswonger Children's Hospital with the addition of 3 floors to include a new state-of-the-art NICU, as well as more space for specialty clinics, so we can ensure the children of our region are receiving the best possible care. We are excited to share more about plans for the Hope Rising campaign and investments in pediatric care for our region in the coming weeks. Thank you for supporting this dream.
Since the Niswonger Children's Hospital Radiothon began more than a decade ago, our community has given more than $3.2 million for babies, children, teenagers, and their families in the Appalachian Highlands. We cannot express our thanks enough to the communities who have so generously supported this cause through your gifts. Because of you, we can dream big. And oh boy, are we dreaming big. As we celebrate our 10th annual Radiothon, we look forward to the Ballad Health Niswonger Children's Network Capital Campaign, which will be an ongoing initiative with a goal of raising $30 million. What started as a dream of a children's hospital for our region has grown into a network of care, reaching beyond the walls of the hospital to set children up for success in all aspects of their lives. Throughout the duration of the capital campaign, we need your help to help make dreams come true for children in our region. As we kick off the capital campaign during this year's Radiothon, interested donors can call 855-611-KIDS. That's 5437 to make their pledge, beginning on March 3rd. Donations can also be accepted at any time by visiting the Niswonger Children's Hospital Radiothon website or texting KITE to 243-725.